A very good evening to all of you. Today we are going to do the MCQ challenge of pathology. See, pathology has a weightage of 25 questions in the NEET PG and about 20 to 22 questions in INICT. So let us begin with the first question. Michaelis-Guttman body are seen in A. Xanthogranulomatosis pyelonephritis, B. Malakoplakia, C. Nail patella syndrome, D. None. What do you think is the correct answer here? See, what is Malakoplakia? Malakoplakia is a variant of cystitis. It is related to chronic bacterial infection, which can be mostly by E. coli or occasionally by Proteus species. It is characterized by unusual appearing macrophage and giant phagosome. It points to defect in phagocytic or degradative function of macrophage. So the correct answer here is B. Malakoplakia. DIC is seen in A. Acute promyelocytic leukemia, B. Acute myelomonocytic leukemia, C. Chronic myeloid leukemia, D. Autoimmune hemolytic anemia. Well, the DIC is associated with promyelocytic leukemia. Acute promyelocytic leukemia AML-M3 constitutes 5 to 10% of all cases of acute myeloid leukemia. So the correct answer here is A. Acute promyelocytic leukemia. Leaky fatty necrosis is seen in A. Heart, B. Brain, C. Lung, D. spleen. Well, of course, it is seen in the brain. Please click the link in the description box to join the 2-day NEET PG Ultimate Breakthrough Blueprint event. Flare interval response is mediated by A. Axon reflex, B. Arteriolar dilatation, C. Histamine release, D. Local hormone. It is seen in axon reflex. Cystic medial necrosis is seen in A. Marfan syndrome, Friedreich ataxia pattern, Down syndrome, Kawasaki disease. It is seen in Marfan syndrome. Now, what are the causes of constrictive pericarditis? A. TB, B. SLE, C. Brucellosis, D. A and B. Now, causes of constrictive pericarditis are idiopathic. Infectious means viral, TB, fungal, parasitic, post-cardiac surgery, post-radiation therapy, connective tissue disorder, uremic, malignant, drug-induced sarcoid. So the correct answer here is D. In cell death, myelin figures are derived from A. Nucleus, B. Cell membrane, C. Cytoplasm, D. Mitochondria. It is cell membrane. Enzyme that protects the brain from free radical injury is myeloperoxidase, superoxide dismutase, MAO hydroxylase. It is superoxide dismutase. Fat necrosis is common in A. Omentum, B. Breast, C. Retroperitoneal fat, D. All of them. It is all of them. In apoptosis, cytochrome C acts through A. APF1, B. BCL2, C. FAD, FADD, and D. TNF. It is APAF1. Which is activated for nuclear fragmentation of apoptosis? A. Caspases, B. APF1, C. Oxygen free radicals. D. All. It is caspases. Annexin V is a marker for A. Apoptosis, B. Necrosis, C. Atherosclerosis, D. Inflammation. It is apoptosis. Which of the following marker is specific for gastrointestinal stromal tumor? A. CD117, CD34, CD23, S100. Specific is CD117 as seen in the table. So correct answer here is A. CD117. Multiple epidermoid cysts are seen in A. Turcot syndrome, Gardner syndrome, Fitzgerald syndrome, familial polypus coli. It is Gardner syndrome. Gardner syndrome include edematous polyp of gastrointestinal tract, desmoid tumor, osteoma, epidermoid cyst, lipoma, dental abnormalities, and periapical carcinoma. So it is Gardner syndrome B. The features of Crohn's disease are all lymphoid hyperplasia, B. Skin lesion, transmural involvement, D. cryptapsis, except lymphoid hyperplasia. Please click the link in the description to join the 2-day Neet PG Ultimate Breakthrough Blueprint, which covers all the 19 subjects in a holistic manner so that you get a good score in your Neet PG exam. The first 10 people who will click the link in the description will get this masterclass absolutely free. Female is affected, male is not. Disease is autosomal dominant. What is the chance in children? A 50% affected, B 25% affected, C 75% affected, D all affected. In fact, it is 50% is affected. If one of the parent, either mother or father, is affected in autosomal dominant disorder, every child has 50% chance of having the disease and 50% chance of not having the disease. The inheritance of familial retinoblastoma is A. Autosomal recessive, B. Autosomal dominant, C. X-linked dominant, D. X-linked recessive. It is autosomal dominant. Male-to-male transmission is seen in autosomal dominant, autosomal recessive, X-linked dominant mitochondrial disease. It is seen in autosomal dominant disease. X chromosome is not transmitted from father to son, and mitochondrial disease are always maternally inherited. Autosomal recessive disease can be transmitted from father to son, but only if mother is also affected or at least if she is a carrier. If only male is affected, autosomal recessive disorder cannot be transmitted to son. So autosomal dominant disorder can be transmitted in any direction, from father to son or daughter, from mother to son or daughter. So correct answer here is A, autosomal dominant. Which is not a feature of Down syndrome? A. Clinodectally, B. Pigmented birthmark, C. Hypotonia, respiratory tract infection. It is pigmented birthmark, which is not a feature of Down syndrome. Line of Jun occur in A. Postmortem clot, B. Infarct, C. Embolus, Correlus thrombus. It is correlate thrombus. Anemia with reticulocytosis is seen in A. Hemolysis, B. Iron deficiency anemia, vitamin B12 deficiency, aplastic anemia. It is hemolysis. Maximum spherocytes are seen in A. Autoimmune hemolytic anemia, B12 deficiency, aplastic anemia, and autoimmune hemolytic anemia. The anemia associated with leukemia is myelocystic anemia. Chemotaxis is mediated by A. Histamine, leukotriene B4 and C5A, leukotriene C4 and C3A, bradykinin. It is leukotriene B4 and C5A. Hyperimmune IgE syndrome is also called A. Job syndrome, Biskott-Aldrich syndrome, Chidiac-Nagaraj syndrome, Dijk's syndrome. It is Job syndrome.